May is Mental Health Awareness Month, so we are at Rivendell Behavioral Health Services of Arkansas here in Benton. Marla Edwards is joining me, who's a therapist here, and we've got to talk all about this because it's such an important topic.
Yes, it is.
When you get a call from families, what are you hearing most often from them?
A lot of times there is some uncertainty on what it is. Is it an emergency? They have concerns, but they're not knowing where to go and a little hesitant to ask questions.
What are some of those signs that they should be looking for in either their child or a loved one that maybe they do need help?
So I would say some increased sadness, withdrawal from family, friends, activities they enjoy, isolation, emotional dysregulation, a lot of emotions and not sure what to do with them. Maybe sleep changes, appetite changes. There are a variety of symptoms and they differ from person to person.
I think it's also important to note that we don't have to wait till it hits a crisis point to call.
That's right. Calling sooner than later, you're not committing to anything, you're just getting knowledge about the concern for yourself or for somebody else, and just starting that conversation.
Maybe there's a thought of, well, I don't necessarily think my mental health is that bad, so I don't want to make a big deal about it. Do you hear that a lot?
Absolutely. Sometimes it's, well, we were trying to see if it would improve. Maybe, when school's out, we'll address it then, and just waiting until they think that it's better, but then it becomes a crisis, and that's a little bit late to be reaching out sometimes.
I think it's also hard to reach out if you don't necessarily know what to expect. So if somebody does reach out to Rivendell, what are those first steps to get started?
Reaching out, calling the phone number, talking to one of our staff. You don't have to have the questions or the answers. Our staff is trained to walk you through it and help you determine what's right for you and your loved one. It may not be that you need to go inpatient to inpatient hospital. It could be that you just get some clarity in what would be the next step, what that looks like.
Is there embarrassment or hesitation about the thought of reaching out and asking for help?
Yes. Sometimes it's, am I making this a crisis when it's really not? Is this something that I'm not sure what it is, and is it mental health? But mental health and physical health go together.
Yeah.
They impact each other.
I'm sure a lot of families are overwhelmed, they're exhausted, they don't know what those next steps are, and that's why you are here to help.
That's right. We wouldn't avoid going to the doctor if it was a physical condition. But sometimes we will postpone mental health concerns. So reach out early.
Marla, if somebody does want to reach out to Rivendell, what is the best way to do that?
You can call us directly. We have a website, and you can get the number off of that. You can send an email, but reach out and they can start the process towards answering questions, and that's usually the hardest part, is taking the first step.
Absolutely. Thank you so much for your time. I really appreciate it.
Thank you.
We'll have more Channel 7 News after this.